Here's a myth that we've been hearing a lot about, like sunscreens acting as endocrine disruptors. So tell us a little bit about the controversy and what the true data is.
These people are so annoying. Sorry, not sorry, but years ago, probably about I feel like about maybe 6 years ago now, there was a study that came out showing hormone disruption with chemical sunscreens. And the really interesting thing about that study, which I think we've talked about in the past, is that they were applying the sunscreen, I think it was 6 or 7 times a day to their full body. I can't remember the duration of the study, but number one, no one is applying sunscreen to their full body 7 times a day.
And at such a high dose
And
that
at
they were
such a
using.
high
Wasn't that study with
dose.
rodents too?
Yeah, I think so.
Yeah. So there was multiple things in that study that were
Not applicable.
that were not applicable.
Real skin, real science, real confidence. With Dr. Zain Hussein. Welcome to
Skinside
Out.
Welcome to Skinside Out. I'm your host, Dr. Zain, with Heather and Courtney. Today we're doing a deep dive into everything sunscreen from the inside out. So let's get right into it. So let's talk about sunscreen and why it matters. Heather, let's start with you.
Sun causes cancer.
Was it?
Yes. So sunlight contains UV or ultraviolet radiation, which can damage your skin. So UVB is much more intense, and that can cause repetitive risks of skin cancer, whereas UVA kind of accrues over time, which is why you don't really see the aging immediately.
So that's absolutely right. So when we are exposed to UV light, we're looking at various wavelengths of light that penetrate, to different degrees in the skin. And that's where we see the effects of it. So when we're prematurely aging with UVA, it's penetrating deeper into the dermis. That's where collagen lives or elastin lives. So that's why we see those changes where you're getting these, wrinkles and just photo damage. Like the elasticity of your skin is a lot, compromised. You definitely look older, but with the burns that you see with UVB, I mean, you see clinically like tans, burns.
Yeah.
And you definitely see also residual sun damage afterwards with presenting with hyperpigmentation and lentigos and things like that.
Mm-hmm.
UV damage is actually a group 1 carcinogen, which is also the same category as tobacco smoke.
Wow.
Fun fact.
But I need my UV light. It gives me vitamin D. We'll get into that.
Yeah.
And according to AAD, the American Academy of Dermatology, skin cancer is the most common cancer in the United States and in the world. Mm-hmm. So it's really important. So therefore, UV radiation is the most common carcinogen.
Mm-hmm. I think people kind of have a bad rap with sunscreen sometimes, and especially people who are very into preventive medicine. And I'm somebody who's very into preventive medicine, but sunscreen is preventative medicine. So I think people often forget that.
It's preventing you from getting skin cancer.
Yeah.
And also wrinkles and a lot of other
lots
things.
of things.
A lot of bad things. So what does SPF actually mean? I feel like a lot of people don't understand what SPF means and how we categorize sunscreens.
SPF stands for Sun Protective Factor.
Say it in unison.
So this is how much is it protecting you against ultraviolet radiation. So yes, SPF 100 will protect you a little bit more than SPF 30, but it's not like
double
drastic.
the protection.
Yeah.
So what are the stats for the different SPF? I find that's really interesting.
Yeah. So SPF 15 blocks 93% of UVB rays. SPF 30 blocks 97%. SPF 50 blocks 98, and SPF 100 blocks 99.
That's pretty damn good.
Yeah.
Right? Even for an SPF 15, that's not bad.
Yeah.
And if you're using it properly, reapplying, you protect yourself from a lot. But as a rule of thumb, I generally recommend SPF 30 or higher because 97% is pretty damn good.
Yeah.
So I think that if you can be consistent with a sunscreen that you like, I think that's far more important than looking at the number per se. Okay. And what does broad spectrum mean? That's another term that a lot of sunscreens have that people don't understand.
Broad spectrum just means that it is covering lots of different wavelengths and kind of covers across the UVA and UVB spectrum, whereas some sunscreens are, I guess, better at being targeted. Ideally, you want broad spectrum because it's helping to minimize your radiation and DNA damage from lots of different wavelengths.
Yeah. And that's why when you see a lot of these broad spectrum sunscreens, many of them are chemical sunscreens, and they're a combination of multiple chemicals to be able to reduce the effects of, a lot of these rays. So we'll get into the different types of sunscreen and how that matters. Let's dive right into that then. So let's talk about the two different categories. So mineral versus chemical sunscreens. Courtney, tell us about mineral sunscreens.
So mineral sunscreens, what you're looking for on the bottle will be either zinc oxide or titanium dioxide. They basically work by like scattering and absorbing the UV radiation. I think it was this belief for a long time that they were just like mirror reflecting the sunlight, but that's not true. They're actually like absorbing that. So a lot of times the mineral sunscreens, I think, tend to be better for more sensitive patients with like sensitive skin. They are typically going to be better for the reef and for the oceans. I know certain places like Hawaii and some other islands have actually banned some of the chemical sunscreens, which we'll get into. But they have much lower allergy rates and they're very stable in the sunlight. So I think it makes for a really great sunscreen choice that universally people can tolerate. I would say the main con is that, and I feel like this was more so like a few years back, I think we're kind of emerging into this era where things are a little bit more cosmetically elegant. But before, there definitely was this like thick, sometimes white cast that the zinc would leave. You might think of like your old lifeguards, like Baywatch, where they have like the thick white on their nose, or like I remember in SpongeBob, like Larry the Lobster. It's a very niche recollection, but Larry the Lobster used to have a little like white cast of zinc, and I never realized it till I was older. I was like, oh, that's sunscreen. But so I think now we've developed much more elegant formulations that really have a more sheer, transparent formulation that people don't feel so heavy in.
Yeah, and then the tinted mineral sunscreens are really elegant too, especially if you want a little bit of coverage. It kind of gives you a nice little glow, and I think that they look really good on certain skin types.
Yeah, I know Heather and I really like the Neutrogena mineral tinted, and they have I think 4 shades, and even like my darkest skin types can use their darkest shade, which I think is really nice because sometimes it will say certain sunscreens will say universally tinted, and there's no way you can create like a universal tint for every skin tone. I mean, it's so it's nice that I think we're having more inclusion in the sunscreen realm.
Yeah. Another advantage of mineral sunscreen is that it's immediately active. Like you put it on and you're ready to go. Whereas chemical sunscreens, you actually have to wait about 15 minutes for it to work.
And the iron oxide in tinted sunscreens can be a little bit more protective, especially if you have some sort of like condition that is sun sensitive. Yeah, photosensitive. So like melasma, for example.
Yeah. All right. So let's get into chemical sunscreens or organic sunscreens.
So chemical sunscreens, you'll hear different names or you'll see different names. So avobenzone, octinoxate, octocrylene, oxybenzone, homosalate, octosalate. There's actually another one that is not approved in the U.S., but in Europe and Asia, bimotrizonol or tinosorb is available as well. So these are all filters that convert UV radiation to heat. So instead of blocking it and reflecting it, they more so absorb it. So some pros, it's usually lightweight. There's not really some sort of like white cast that we typically see with chemical-based sunscreens. And it's usually easy to layer under makeup for those who wear makeup. But I think some cons, there's some higher chance of irritation. So especially if you have sensitive skin, like rosacea, for example, does not do well with chemical-based sunscreens. And it requires a stabilizer, so something to keep it at its peak level. Yeah. But both are effective.
And it's better to wear a sunscreen than to not wear any.
Yeah.
So.
And I will say, so a lot of times companies will advertise something as a mineral-based sunscreen, but if you look at the active ingredients, it might be a combo, mineral and chemical. So they try to trick you. Yeah.
Deceptive. All right, so let's talk about one of the common reactions we see with certain sunscreens and why some people don't want to wear sunscreen: allergic contact dermatitis. So tell me a little about what we've seen in the clinic and why it happens.
So if you haven't listened to our previous episode on allergies, you should look into that. But allergic contact dermatitis is a delayed immune reaction that can happen usually like 1 to 3 days after exposure. It usually is a red, itchy rash and sometimes has blistering. So a true allergy to a sunscreen filter is very uncommon, but you can also have different chemicals that are sensitive to light and react to light as well.
What are the most common filters that we see this with?
Oxybenzone and octocrylene, I think.
Those are the biggies.
Yeah.
And then distinguishing between true allergy and irritation. So, Courtney, what do we see with a person who just has an irritation?
Maybe some like tingling, some, temporary like hives, I think sometimes can happen. When you apply it, you kind of have that like burning sensation. True allergy is going to be usually more like uniform and I would say like takes a little bit longer to treat, kind of stays a little bit longer.
Yeah. Mineral sunscreens typically have a lower risk of developing contact dermatitis because they're chemically inert, right? They're minerals. Zinc and titanium, typically don't cause as much allergenicity as these other chemical organic sunscreens.
Yeah. And they use zinc for babies, so,
Yeah, diaper paste.
Yeah.
Yeah.
All right, so here's a myth that we've been hearing a lot about, like sunscreens acting as endocrine disruptors. So tell us a little bit about the controversy and what the true data is.
These people are so annoying. Sorry, not sorry, but years ago, probably about I feel like about maybe 6 years ago now, there was like a study that came out showing like hormone disruption with chemical sunscreens. And the really interesting thing about that study, which I think we've talked about in the past, is that they were applying the sunscreen, I think it was like 6 or 7 times a day to their full body. I can't remember the duration of the study, but number one, no one is applying sunscreen to their full body 7 times a day.
And at such a high dose that they were using.
Wasn't that study with rodents too?
Yeah, I think so.
Yeah. So there was multiple things in that study that were
not applicable.
that were not applicable. And then people just people see headlines, they don't read. So I think people just really took off with that, and they're like, "Oh, I'm not giving my child chemical sunscreen because it's going to disrupt their hormones." And that's obviously a myth. That's not true.
Yeah, it's like with all those preservatives. The PABA, this and that. Oh, I'm not going to use this, cream because it has all these preservatives. But the preservatives are preventing your products from growing bacteria and viruses and fungi, which will cause skin infections. So I always tell my patients, you got to look at the data and the science.
Yeah, and there's no strong human studies showing that sunscreen causes infertility, thyroid disorders, and puberty changes.
Yeah.
But there is studies showing that that UV causes cancer. So.
Are you sure about that?
One more time for the people in the back.
So risk benefit.
Yeah.
Yeah. Another myth we typically hear about is the vitamin D argument, that we're not getting enough vitamin D production because we're not being exposed to UV light from the sun. Tell me about it.
I don't think people apply enough sunscreen to block vitamin D production. And you can get vitamin D from foods, supplements, vitamin D rich foods, lots of different ways.
Yeah. You don't have to get it from the sun.
Weird conspiracy, but I was never deficient until I started working in derm. Just kidding. No, I just take a supplement. Yeah, just take a supplement.
All right, so what about this one? Darker skin types don't need to use sunscreen because they can't get skin cancer.
That's incorrect.
It's myth. I wish we had our little truth in myth.
Yeah.
Just keep it on myth.
Melanin offers a natural protection from the sun. So you can kind of think of like darker skin types or skin of color as having an umbrella on their skin, but it's not completely blocking UV radiation.
Yeah, I mean, I've done skin cancer surgery and Mohs on, darker skin types, Hispanic, Middle Eastern, Indian, African American, and, these patients all, were shocked to know that they had skin cancer, that they could get it. And I think it's just a lack of awareness.
Mm-hmm. In darker skin tones, the melanin is roughly equivalent to SPF 13. So although, it may be a little protective, it's not going to prevent hyperpigmentation, photoaging, and skin cancer.
Mm-hmm. All right, let's talk about sunscreen and nanoparticles. So typically with a micronized mineral sunscreens. So what's the controversy?
Well, I think to kind of explain what the nano-sized or nanoparticles are, so these are smaller particles that are often used in the mineral-based sunscreens, so like nano zinc or titanium to reduce the white cast. And I think this is something that is becoming more popular, like you were mentioning, the more cosmetically elegant mineral-based sunscreens. And so the nanoparticles can definitely help in that sense.
And what's the data? Is there any harm to these nanoparticles?
So current evidence doesn't really show that any sort of penetration goes beyond the outer skin layers. Mm-hmm. And there's not really much systemic absorption on intact skin.
If you're worried about nanoparticles, then you better be worried about microplastics, and you better never see you drink from plastic, because I think the microplastics are a lot more
Microplastics
scary.
are a bigger problem.
They're a much bigger problem to deal with than the nanoparticles.
Yeah.
All right. So I'm going to give this one to you, Courtney, since you love the earth. Oh, yeah, you too. Sorry.
She shops at REI like she's so much more earthy than
I
me.
recycle.
Oh, that's right. That's
Yeah,
right.
she recycles.
You don't recycle?
No.
Oh, my God.
Don't
Okay.
get that's another tale for
What
another.
happens to your recycling, though?
What exactly
Does it
are
just
they?
go to the same place?
It does. They're not divvying it out. Let's be honest. We'll save that episode for another day. Not that that's
You
related
don't
to
know about these
dermatology.
people that sift through the recycling, and they sift. There's people who are hired to do that.
Like, I will buy jarred stuff and reuse my jar. I wouldn't doubt it, because people do.
I can't believe
weird
you said
things.
she was more earth conscious.
I know.
than me.
No, because she talked about the reefs before, so that's why that's what.
Okay, I'm more oceanic.
The coral reefs of Hawaii.
Giving Ariel. You know what? Protect the earth, protect the fish, and protect the coral reefs, which are dying at a rapid rate because of global warming. Okay, so
I love finding Nemo.
yeah, the anemones. But like I said earlier, I mean, there are places that are banning the chemical sunscreens. You can't buy them. I definitely know in the Caribbean, whenever I've traveled down there, it's just all mineral based sunscreen. Hawaii is another place. So I think, just switching over to a mineral based sunscreen while you're out, if you are going to be in the ocean, why not? Yeah, why not?
Why not?
And then let's talk about how much sunscreen do we actually need to use to give ourselves optimal protection?
More than you think. I think
Definitely.
people don't apply enough and people don't reapply. So for your face and neck, you need 2 finger lengths of sunscreen. So all the way down your fingers, that's enough for your face and neck every 2 hours. To cover your entire body is either a golf ball size or a shot glass full of sunscreen, which is a lot.
Really? See, I think about a shot glass, and I'm like, that's not a lot. I feel like I'd be dousing myself.
I don't know.
Shot glass is a lot.
I think when we did that
Yeah.
Demo where we actually
Yeah, I
had
was
a shot
squeezing
glass
it. I'm
there,
like, that's a lot.
yeah, it was a lot to get in
Really?
there.
Maybe
yeah.
I need the demo.
Yeah.
Yeah,
I'm not usually
Just
putting
bring a shot
sunscreen in my
glass.
shot glasses. So maybe it doesn't feel like a lot.
Yeah, but not only reapplying after 2 hours, but also reapplying after heavy sweating or swimming.
Yeah. Mm-hmm. So Amna is the worst with sunscreen. She does a pea-sized amount of sunscreen. I'm like, that's not a retinoid. That's your sunscreen. She's like, whatever. I'm like, no, girl, you got to use more.
And then I think also just like reminding patients because, and I've been guilty of this, where like you have these commonly missed places, especially when you're getting a lot of sun, like at the beach or something. But like on the ears, especially for men who don't have hair covering those areas, the back of the neck, the back of the hands, scalp. My mom has really thin hair after her chemo, so she actually got like a spray sunscreen that she can spray on her scalp, or most times she'll just wear a hat. I've been bad about sometimes the back of my knees. I don't know if you guys have ever had that, but like
sweating.
No,
like, you
just
forget that.
I got my legs,
Oh,
but I
really?
miss the back of my knees, and I
feel
say I'm probably gonna get skin cancer there because I
Really?
always get burnt there.
That's
yeah.
one area that I sweat a lot.
Oh,
It
that too.
Yeah, and so I feel like it just like is gone in like
Yeah, I
10
always
minutes.
burn any vacation I have. Like
Really?
yeah, the back of my knees.
I was really bad with my scalp. I would never have thought to put sunscreen in my scalp. As
yeah,
a
they make a
teenager.
powder, and they well now, but
Yeah.
yeah, they probably didn't back then.
Yeah.
Not that you're like back in her day.
Yeah.
I always forget to put it on my feet, and then I get the flip-flop
Yeah.
hands.
Ouch.
Yeah.
That hurts. That does hurt.
Yeah.
All right, and let's talk about aging and sunscreen. So how can sunscreen help us keep looking young?
Fewer wrinkles, less pigmentation, and better skin elasticity if you protect yourself.
Yeah. And honestly, like the premature aging that you see with sun exposure is very difficult to treat. It never gets back to its full integrity.
Yeah.
So even though we have a lot of great lasers and energy-based devices, it still never gets back to that quality. So you can definitely tell someone who's protected their skin's a lot more youthful. They got more collagen and elastin, and it just looks better.
I think people are so quick to spend and splurge on like an anti-aging serum or something like that, but they're forgetting their sunscreen, and I don't think that's replaceable.
Yeah.
And reminder that, it's a cumulative. People are like, oh, I'm never outside. I hate when people say that because you don't go to your mailbox to get your mail. You don't go to the grocery store. You don't walk your dog. Like you are outside.
You're next to a
and
window.
You're next to a window. And that accumulation, I think they say like 7 days of accumulation is worth like 1 day at the beach. So that accumulation does build over time. So wear your sunscreen.
Yeah.
And there are some really cool sunscreens that have like these DNA repair enzymes in it, like Isden.
Isden, yeah.
Yeah, so I thought that was really cool when they came out with that sunscreen. And
I was on that train.
I was recommending
I was
it to every patient.
All this damage.
I like I like that tinted one. What was that?
The
Air,
Isden?
They
yeah,
had
Air
the-
Fotona.
Fotona does. The one
Actinica
that's
or-
the ageless, I think that was called.
Yeah,
Yeah,
yeah.
I really like that formulation.
Yeah.
Yeah, the Actinica I think was the
First one.
untinted.
Yeah,
Yeah,
cool.
good stuff.
All right, so we went through a lot of misconceptions and myths about sunscreen, so let's recap.
Wear your sunscreen. If you've learned anything from today's episode, wear your sunscreen. If you're more sensitive, maybe just switch over to a mineral-based sunscreen. If you are going to the beach, maybe wear a mineral-based sunscreen. But it's better to wear a sunscreen rather than no sunscreen.
My take is be consistent. It's a habit that you have to get into. The internet loves switching things up and creating hypothetical risks. And I think you just need to look at the science or speak to your dermatology provider.
Yeah, I agree. And we know that UV light is a carcinogen. It causes cancer. All these other things that we're hearing about, these nanoparticles, not the microplastics.
Microplastics are still bad.
So we know that UV light is a carcinogen. So there's tons of data, many papers in the literature that show the evidence. However, all these unsubstantiated myths that we hear about, like the ones that hey, I'm not getting enough vitamin D. We're going to be vitamin D deficient if we don't get our sun exposure, or these sunscreens will disrupt my endocrine system or cause hormonal changes, or these nanoparticles will also damage my body. There's no evidence. And it's really important to look at the science. And just like Heather had said, really you have to look at the evidence out there. And it's just really important not to be swept away by social media and myths.
Don't let misinformation burn you.
Yeah.
But don't.
Okay, slay. You know, I don't want to
right.
hear any comments from any trad wives that are like, but I use my beef tallow and I'm fine.
Oh my god.
I make my sunscreen from home.
Yeah, I make my sunscreen in my kitchen.
Well, on that note, I think that we've discussed sunscreen, from the inside out. So I think that this wraps it up. So if you have any questions, feel free to contact us. Please feel free to like, subscribe. Until next time, Skinside
Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.